Back to America's new investment in the global fight against COVID-19. President Biden is set to officially announce in England today that the U.S. plans to donate 500 million doses of the Pfizer vaccine to countries that need it most. The doses will get distributed to nearly 100 countries over the next 12 months, with the first 200 million doses going out this year. The International Vaccine Initiative, COVAX, is heavily involved in the process. Earlier on CBS This Morning, White House Press Secretary Jen Psaki stressed the importance of the U.S. effort to vaccinate the rest of the globe.
We are by far and away, the United States is the largest contributor to vaccine doses around the world, because we know that's not only the right thing to do, but it's also a smart thing to do to ensure we're keeping the American people safe. And this is just the beginning. We're going to help boost manufacturing in the United States, get more doses out. We're going to ensure countries have the know-how to produce vaccines, and we're going to help make sure countries have raw materials and medical supplies needed to help get this pandemic under control. And we're going to lead the effort from the United States.
Joining us now is Dr. Amish Adalja, who's an infectious disease expert and a senior scholar at the Johns Hopkins University Bloomberg School of Public Health. So, Doctor, the U.S. is facing pressure to improve vaccination rates in poor countries. Explain why helping other nations' vaccination efforts is so important when it comes to containing this virus. And it's frankly not the first time the United States has done that. We've led the vaccination efforts in the past when it comes to polio, for example, and smallpox before that.
You have to remember that when you have an infectious disease outbreak spilling out of control in any corner of the globe, it's going to impact the rest of the world. We will still have disrupted trade. We will have disrupted travel. We still will have new variants being generated. We will still be sort of out in the acute phase of the pandemic as a planet until this is controlled in all corners of the globe. So I think it's really important to try and go after COVID-19 wherever it's finding safe harbor in certain countries and really remove its ability to cause serious disease, hospitalizations and deaths wherever it may be occurring. And that's how we truly go into a post-pandemic world.
So providing the doses is one thing, but I imagine that support to make sure that those doses are administered is also something that some of these countries would need. What else can the Biden administration do?
You can make sure that they have the actual infrastructure to deliver the doses. We saw early on in our vaccine rollout that it was difficult to get shots into people's arms. We have to make sure that other countries can do that as well by giving them the resources. If you're using vaccines, for example, that require extreme cold storage, that they have that technology, that they actually have vaccinators, that they actually have needles and syringes, that they have the ability to transport vaccine throughout their country. So these are big undertakings, especially in resource-poor countries that don't have much infrastructure and rely on donor countries as well as the World Health Organization and other NGO-type organizations to scale up their vaccination program. So this is going to be a process that probably will take us into 2022.